What is infertility? Infertility simply means the inability of a woman to conceive after a long period of trial, and inability of a man to impregnate a woman for one reason or another. We have two types of infertility. We have primary infertility and secondary infertility. Primary infertility is the inability of a woman to conceive at all, or of a man to impregnate a woman. Secondary infertility simply means that there was a time when the man or woman was fertile but is no longer fertile. So a woman may give birth to one or two kids and suddenly find herself unable to be pregnant again. This is secondary infertility. So whenever there is any case of infertility, it is important to find out which of the couple has complications. So these investigations may lead to one of the cases I'm going to mention now. The first one is when one of the couple is not well. The woman may be suffering from anovulation, that is, absence of ovulation, or ovarian cyst. The man may have a low sperm count. In this case, the partner involved should be treated. The second point is when both partners are involved. In this case, the man may have low sperm count and the woman may also be experiencing an ovulation. So this case is more complicated than the first point and it requires cooperation and understanding between the couple. Then the third one is when no diagnosis can be made. These very points can be frustrating. So some will start saying that it is witchcraft or evil spirits. So there is no medical reason why the couple cannot achieve pregnancy. This will make the couple to start visiting native doctors who will start accusing their friends or their relatives. So do not be deceived, okay? With God, all things are possible. So what are the causes of female infertility? The first point is anovulation. This is when ovulation fails to occur or when it is not regular. This may be due to emotional imbalance or wrong medication. So when trying to conceive, don't take drugs anyhow, okay, to avoid an ovulation. Then the second cause of female infertility is what? Hormonal deficiencies, okay. So insufficient production of some hormones such as progesterone can lead to infertility. In as much as progesterone permits conception, okay, too much of this progesterone can also prevent implantation and nourishment of fertilized egg. So always make sure that your hormones are in check by performing hormonal tests to know the ranges of your hormones, okay. Then another thing that can cause female infertility is infections. This can lead to scarring and adhesions of the uterus, ovaries, or fallopian tubes. So always treat any form of infection, be it urinary tract infection or pelvic inflammatory diseases. Always treat them. Don't overlook any form of infection, even as simple as candidiasis. Always treat them because it can lead to infertility with time. That is for infection. Then the fourth point is endometriosis. This is a disorder in which the tissue that normally lines the uterus, they grow outside the uterus. The tissue can be found on the ovaries or fallopian tubes, you know. They can be found even in the intestines. So The cause of this endometriosis is not yet known. It is common if although it is common, yeah, but if left untreated, okay, it can also lead to infertility. So another thing that can cause infertility in female is cervical infection or cervical blockage. So this one occurs when polyps or very thick mucus block the cervix and make it impassable for semen, okay. Then uterine tumors or malpositioning can also cause female infertility. So example of this uterine tumor is fibroid, okay. Fibroid may not prevent conception but often leads to miscarriage, okay. So the uterus to not positioning well can also lead to miscarriage. So whenever you are undergoing treatment for infertility and your doctor advise you to remove the fibroid, always listen to them because they know the best for you. Don't listen to friends by taking some medication saying that you want to pass the fibroid through physics, or you want it to melt. Fibroid, the medical treatment for fibroid is surgical removal. Once you remove it, you are good to go. There is no cause for alarm. Then unhealthy lifestyle too can also lead to infertility in female. So one of the major causes of this infertility is the way we live our lives. We have drifted away from nature, and we are paying for it now. We need to re-examine ourselves very well and look out the way we live our lives and our relationship with God, okay. Not only with God, with others, even with ourselves and with the environment around us. Let's always go for natural foods that nourishes our body, okay. Go for more of organic food, because all these fries that we eat, all these processed food too, they are contributing to infertility in a very huge way. So another thing that can lead to female infertility is contraceptives and abortions. So some women always complain that when they were single, they got pregnant easily, but immediately they got married, they cannot conceive again. So most infertile women, they have undergone an abortion for at least 2 or 3 times, okay. So most of these abortions are being performed by incompetent doctors. So please, if you are not married and you are watching this video, please preserve your fecundity, okay, by not tampering with your wombs. So when people have miscarriages before marriage, all these things, most of these people that are experiencing infertility, not all, but at least some or majority of them, if they can tell themselves the truth, they've experienced once miscarriage or twice. They've experienced abortion, I mean to say. So these are one of the causes of infertility when they get married. So what are the causes of male infertility? So apart from wrong lifestyle like heavy alcohol consumption, men, they like alcohol, but alcohol is good for the body, but when you consume it at larger quantity, it affects your semen. So aside heavy alcohol consumption, spiritual weaknesses, and other related factors, okay, what I'm going to mention now are causes of male infertility. The first among them is azoospermia. Azoospermia is when there is absence of spermatozoa in a semen, okay. When a man ejaculates, if there is no single spermatozoa in that sample, then it is simply azoospermia. Then we also have oligospermia. Oligospermia is low sperm count, that is fewer spermatozoa are being present in that semen. So with treatment, this oligospermia will improve and be able to impregnate a woman. Another thing that can cause male infertility is infection too. So a lot of men, they suffer from one infection or the other. So if these infections are not treated, okay, it leads to death of spermatozoa. So most men, they don't like accepting that something is wrong with them. When you tell them to go for infection tests, they always advise their wives to go, and it's bad. When it comes to conception, both couple need to cooperate well, okay? As the woman is running tests, the man should be running his own test too, so that we will know where the problem is coming from. But when the wife, when they come to the lab to run tests, you advise them, come with your partner. They will tell you that they are not compliant, that they are not coming. Even when they come to the lab and submit their urine sample, if you tell them that we will need your semen for analysis and culture, they will tell you that nothing is wrong with them, that they are not even producing that sample. And without semen sample, you cannot tell if a man is having issue or not. So there is nothing wrong with submitting your semen sample for analysis. So if you are a man and you are watching this video, whether you are suffering from infertility or not, you can use your semen for culture to know if there is infection. Feel free to always produce your semen sample for test, okay? So that is for infection. Another thing that can cause male infertility is undescended testicle. So although this one is rare in full-term babies, undescended testicles are common in preterm babies, but also treatable at the same time. So a testicle that has not moved into the normal place in the scrotum, okay, the person will always experience infertility. So another thing is heat. Heat affects spermatozoa. Wearing of tight shorts. Some men are fond of wearing tight pants, okay, it's not good for sperm production. Okay, so when you wear tight shorts or underwears, driving for a long hours can generate too much heat, okay, and that may interfere with the maturation of spermatozoa. Then, what are the laboratory diagnoses for couples that are trying to conceive? For the woman, the test to be done is high vaginal swab. When you come to the lab, a sterile swab stick is being used to collect sample from your vagina, either high vaginal swab or endocervical swab, and then your urine sample. Then for the man is semen sample and urine sample too. So these are the basic tests that are being done to know if the woman has infection and to know if the sperm count of the man is within the normal range or below, okay? So after this test is being done, pelvic scan is also important for the woman to determine if the ovaries are normal and to check for uterine tumors, okay? So beside pelvic scan, you can also take record of your body temperature immediately after waking up from sleep in the morning. Always check your temperature, okay, because ovulation is preceded by a slight rise in temperature. So keeping track of body temperature fluctuations help determine if one is ovulating and when ovulation is occurring. So if you are trying to conceive, for the woman, it's good to always track your body temperature. Get your own thermometer. Whenever you wake up, you check your temperature and keep documenting it. It will help you to know whether you are ovulating and when you are ovulating, okay? So another test is hormonal test. Hormonal test is very important. So always check your hormone